Man, you are drunk.
Yes, I am. I also saved your life. At least for now.
I love House's dark humor. It makes him so memorable. I wonder if he can use it to escape towards Sister when she hits him with a leather slipper though. At least that's what would happen in real life if a doctor decided to go on a midday bender with a patient. House MD Acceptance. It's the first episode of season 2. Let's see if I can get the diagnosis first while I give you my insights as a doctor working in the UK. Let's get started.
Open the door! Open the door!
What happened to you, man?
You better stay How did you do me like that? I'm your brother. I never did you.
Okay, juicy start. He's got hallucinations on death row. Clarence has been a bad man, but we do not discriminate in healthcare. Even murderers get our treatment in hospital. I had to treat a man once who committed crimes against children. It didn't feel right, but it was the right thing to do. Now, Clarence is hallucinating and clearly suffering from a heart problem. The first thing the average doctor is going to think of here is drugs, with him being a prisoner, of course. But I bet my medical license that he's gonna be totally clean. These hallucinations are probably due to acute psychosis, secondary to poisoning of some sort, maybe death rows put together, like some heavy metal coating on the prison bars, and he's been poisoned, or he's been sneaking mobile phones in where the sun don't shine and one of the battery has leaked there. Who knows? Let's find out. Need more clues.
Too dangerous to house him in the infirmary. You don't have to worry. We've taken every precaution. I've had my men clear from the cell all pens, paper clips, and staplers. Any supplies that might be used as a weapon.
Paper clips as a weapon. If you get killed by a paperclip, then I'm sorry. I'm gonna say it. You probably weren't robust enough for this world anyway, and the man was doing you a favor.
Bluish tinge to the fingernails, lips. He's hypoxic. He's got fluid in his lungs, breathing rate of 50. He needs to be intubated and put on a respirator.
Don't have a respirator. No way a death row inmate leaves my prison.
Okay, this guy's clearly dying, but he's on death row anyway. Should they have just left him? Why save him? Let nature do our job for us.
You work fast.
So do you.
Is that a shock?
Yeah. It was easy. Once I convinced the clerk to take it to Judge Markham, she's a sucker for Eighth Amendment arguments.
Stop. I'm getting turned on.
House is the only man that can convince not his friend, not his sister, but his ex-wife to win a court case for him faster than you can say divorce settlement. Brilliant.
Water.
Ooh, how thirsty do you have to be to pull out the tube that is keeping you alive? So, causes of excessive thirst, things like cocaine, MDMA use, diabetes, potentially diabetes insipidus, where your kidneys are actually insensitive to antidiuretic hormone. That can be peripheral, i.e. Based on where your kidneys are, or it could be central with a problem like a tumor or demyelination inside the brain. We already know that he's got effusions in the lung and in the heart, which could be due to overload. But when they put the catheter in, they would have noticed that this man would have started producing a yellow Niagara Falls if that were the case. So maybe it isn't diabetes insipidus. Let's see what other excessive thirst causes it could be. It's interesting.
We upped his saline drip. He's fine now.
Blood and urine test came back clean. No sign of opiates in his system.
I knew it. They thought it was drugs. It's not drugs. Call me real life Dr. House. Now I would be doing an arterial blood gas on this patient with a full blood screen and sodium urine osmolarities, and could be doing a water deprivation test for diabetes insipidus. I would also definitely take a sample of the effusion in his lungs, and I would do an echo of the heart to check his ejection fraction and see if he has any valvular abnormalities. Do a CT scan of his head because of the excessive aggression, which could be seen as confusion, and an MRI after if the CT was inadequate. Then I would do spinal tap, if safe, to check if he has meningoencephalitis, as it seems that, you know, this aggression has started like within the last few years. Maybe it could be related to some kind of brain infection. My guess that he has a progressive disease that affects his limbic system in his brain and controls his emotions, that causes outbursts, and basically end up with him murdering someone and landing on death row. If that is the case, should we sentence the disease to death instead of the patient? Who knows?
You got some gang ink? Let me see that.
It's a Native American symbol. It means the force of life.
I'm gang banging away in that white coat.
How's a brother like you go from loving a woman to punching her skull in?
Ooh, you know what I find so frustrating is that just because someone is the same race as you, they think that they can ask you the most invasive questions and say whatever they want. I get this in work all the time. I once had this Arabic patient come in and start asking me where my parents were from, what religion or sect they are, and then glorifying Saddam Hussein because he finds out that I'm Iraqi. It's like, bro, you're here to get your testicles checked. Just let me do my job.
Blood gas came back with a pH of 7.28 and decreased HCO3.
Have a new symptom. Anion Gap Acidosis.
Oh, they did the blood gas. Thanks for listening to me, Foreman. Now, what on earth is anion gap acidosis? Well, there's a pretty big mistake here because they should actually say what the anion gap is. Is it normal anion gap, high or low? But I guess since they're mentioning it, we can assume that it's a high anion gap metabolic acidosis. So to explain what it is, basically usually all positive and negatively charged ions in the blood are in balance. But sometimes when you get extra changes in certain types of conditions, then that balance actually moves off in different directions. The body then compensates. So if we lose lots of sodium, your body starts to reabsorb it. Now there is usually an anion gap under normal circumstances. You have an anion gap, I have an anion gap. You can even calculate it by taking your sodium levels and subtracting your bicarbonate and chloride levels. It should be between 8 and 16 milliequivalents. The reason why it's helpful is because there are so many different causes of metabolic acidosis that this helps to narrow down the number of causes it could be. We remember high anion gap causes by the acronym MUD piles. So the M is methanol, U is uremia, D is for DKA, P is for paraaldehyde, I is for isoniazid use or iron overdose, L is for lactic acidosis, E is for ethylene glycol, and S is for salicylate. Now there are a few of these causes that could be applicable here, like methanol or ethylene glycol, more commonly known as antifreeze. Sometimes alcoholics take when they can't get hold of alcohol. That could be a possibility. Sometimes people overdose with them as well. Or isoniazid is an anti-TB medication. TB is more common in prisons. So, I mean, he could be treated for TB, but then they would have access to his medical records and they would be able to see that, unless it's like some other niche thing. The reason why this guy's taking isoniazid, I don't know. Let's find out. We need more clues again.
INH?
Yahtzee.
Drugs for tuberculosis.
Nearly a quarter of the prison population is infected with TB.
Clever entrepreneur like Foreman here chops up his meds, passes it off as heroin.
INH poisoning would explain all the symptoms.
What? Seriously, did I just get that? Okay, I got lucky though, assuming that it was high anion gap metabolic acidosis, because they didn't really make that clear. And I kind of didn't really understand the bit about him getting isoniazid from a different prisoner. How on earth did House figure that one out so quickly? That this guy was spiked. So yeah, I didn't think of that. Maybe I won't nominate myself for a Nobel Prize just yet.
Bradycardia. His heart rate's dropped to 30. It's not gonna hold on much longer.
You just waiting to call time of death, or you gonna give him atropine?
Temporary fix?
Right. I don't know why those diabetics are all hung up on insulin. They're just gonna have to take more.
This patient is not looking good at all. Atropine might help him a little bit because you see the body lives in a state of constant balance between your fight and flight sympathetic nervous system and your rest and digest parasympathetic nervous system. Since this death row chap's heart rate is 30, that means his rest and digest system is winning, and if you block the neurotransmitters, acetylcholine at the synapses, then you can basically help the fight and flight system to take over and increase the patient's heart rate again. Now, that being said, they've done plenty of studies about using atropine in peri-arrest situations, and they found that it doesn't actually change the outcomes, although a lot of those studies are later than when this episode was published, so I might give House a pass on that.
Why does a guy who's on death row suddenly try to off himself? No, you drank that copier fluid.
I had to take control of something, right? Figured that was as good as anything.
Many patients who self-harm state taking back control as a reason for them doing it. I recently had a patient who I saw about 1 month before him attempting suicide. He had 2 kids at home and he jumped from a first floor balcony. His intention was to end his life, but he did actually only end up breaking his leg. I felt such responsibility for this guy because I saw him earlier, but when I did, there were no signs of this intent to harm himself. Sometimes you just can't change these things, but it still feels horrendous when it happens. You may be wondering why House is actually getting smashed with the patient. Well, the antidote to methanol poisoning is alcohol. It binds the byproducts of methanol use. This is the only time that you'll see a doctor prescribing booze for a patient.
Man, you got drunk.
Yes, I am. I also saved your life. At least for now.
I love House's dark humor. It makes him so memorable. I wonder if he can use it to escape the ward sister when she hits him with a leather slipper though. At least that's what would happen in real life if a doctor decided to go on a midday bender with a patient. I still think there's more to this case than meets the eye. I bet he's going to deteriorate somehow. We still haven't quite explained the hallucinations. Maybe it was the hallucinations that told him to kill himself, and that's the cause of this methanol overdose. Let's see.
His heart went nuts before he got stuck in that storage cell and chugged a toner martini. I think there's something going on in his head. Check for intracranial lesions, brain infections, autoimmune diseases, do a CT, LP, full workup.
Okay, now I'm gonna nominate myself for a Nobel Prize because I got brain infection about 20 minutes ago. Now we just need to wait and see if there is an intracranial process like vasculitis or diabetes insipidus. Who knows?
Describe it as a shooting pain, a throbbing pain, or maybe an imaginary pain because you don't want to go back to prison.
Where does it hurt?
My God, I feel like I'm getting stabbed.
I don't think he's faking this stuff.
Nothing is worse than when a doctor dismisses a patient's symptoms. Since we don't feel the pain a patient feels, and we see hundreds of patients with pain, it's easy to get desensitized to it, and that means that you lose that empathy. If you get to that point when you're a doctor, it means you really need a break because you can't do your job anymore without empathy. You need empathy to be a good doctor. It might seem like House doesn't have any, but who was there to give the patient atropine? Who got him transferred from the prison to the hospital? He talks like a hardened captain, but then he acts like Mother Teresa, and that's why we love him. So rectal bleeding makes vasculitis now more likely. It could also cause the brain problems, and you may not see it until an MRI is done of his head. The CT seems like it was negative.
Feel what?
I don't even remember. It's just a fancy way of saying small adrenaline-secreting tumor. Yeah, I clarified it for you. All you need to know is if I'm right, we can fix it.
What? He has a pheochromocytoma! That is BS. His blood pressure was 90/60 on the monitor earlier in the episode, which is low. With a pheo, his BP would be high. He would also have a headache and be sweating with anxiety. Damn, good diagnosis though. I am a little bit salty that I didn't get that. Is not so obscure like ragged red fiber or primary amoebic meningoencephalitis, so I'm kind of kicking myself.
He's cured. That tumor caused random shots of adrenaline, which obviously led to the rage attacks that made him become a murderer in the first place. We could testify Clarence's appeal.
Oh, so I was right. There was an organic cause to Clarence's murders. See, with medical support, Clarence might be able to get his sentence changed so he isn't executed. That is crazy. Do you think he should be executed still, or is the tumor responsible for his murders? Let me know in the comment section below. Amazing episode in terms of story, as always. A few medical inaccuracies, but overall, still definitely good. With these earlier episodes in the season, I can definitely feel that the complexity isn't quite as high as it is in the later seasons. Do you notice that? Anyways, watch another episode here. Thank you for all your support. What are we gonna do when we run out of House episodes? We are burning through them. Stay curious. I'm Sermed.